Tonight,
there were several irregular heartbeat rhythms that I had.
An ABC27 special presentation.
This is a new technology called Pulsed Field Ablation. It seems to be very selective to cardiac tissue.
It felt like I was brought back to life, honestly.
Heart to Heart, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. February is American Heart Month, a month dedicated to learning about ways to keep your heart healthy. And there's a reason why. Heart disease is the leading cause of death among men and women in the United States. In fact, one person dies every 33 seconds from cardiovascular disease. Statistics show men are at a higher risk of heart disease than women. Tonight's specialists from Penn State Health, Heart and Vascular will answer some important questions like, what are the risk factors associated with heart disease? What are the latest treatment options? Can heart disease be prevented? And if you have questions at home, Janelle Knight is here to tell you how to get them answered. Hi, Janelle.
Hi, Deborah. I just wanted to tell you that Dr. Sudhanshu Bhatnagar, cardiologist at Penn State Health Lancaster Medical Center, is answering a lot of questions tonight live in our web chat until 8 o'clock. To submit questions, go to abc27.com/heartchat. I'll be back later in the show to share some of those answers. We'll be right back. Back to you, Deborah.
Thanks, Janelle. Lois Angelisanti scheduled a routine blood work appointment on her lunch break to prepare for an upcoming planned ankle surgery. To her surprise, tests showed that she was having a heart attack right then and there, and her life was about to change forever. Here's Lois's journey.
I was dying. I was at death's door. Anytime my heart was going to go. The transplant was an absolute miracle. I could do everything that I could do before. I'm a whole person again. Hershey Medical Center was absolutely, positively amazing. I just can't get over the amount of support that I had. It just feels like a miracle. I had multiple heart attacks before the one that was found. I worked in an operating room, and I was also going to college full time. I was really stressed out, and I needed ankle surgery because my foot was hurting badly. And I went in on a Friday to have my pre-op check done, and I was on my lunch break, and I said, hurry up, I got to get back. I have another case. And they did that 12-lead EKG, and the nurse asked me how I was feeling. And I said, I feel fine. I said, hurry up, though. Come on, I got to go. She walked out of the room, and she came back with doctors. And I was like, what are you doing? And they said, you're having a heart attack, Lois. And I said, I am not. 20 minutes later, I was on the table having a cardiac cath. It was like, bam.
We say about a third of heart attacks occur without the patient knowing. The nerves inside our body are very different than the nerves that go to your fingers and toes and other places in your body, and that was the case with Lois. So when she showed up, she already had a significantly damaged heart and was beginning to struggle with symptoms of heart failure.
Heart failure is a situation where, for a variety of reasons, the heart does not efficiently pump blood to the vital organs, the brain, the kidney, the intestines, et cetera, et cetera.
When they went in and looked here, I had so many heart attacks before that I already had cardiomyopathy. As time went by, I had treatments, I had medications. My heart started to get aggressively more bad. I couldn't walk, I couldn't comb my hair, I couldn't do anything. I was very, 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 very sick.
She had a very serious and indeed life-threatening heart problem, and she took it like a trooper. She would say, all right, what are we going to do next? She and I became a very good team for years in trying to navigate through her cardiomyopathy and congestive heart failure. And she did well for a while, but then she started to kind of decline a little bit. 6 months later, she really declined further. I don't think it took a long time before she was on the list.
When he realized that my cardiomyopathy was so aggressive, he got on the phone right away to Hershey Medical Center, and he got me an appointment the very next day. And thank God for that.
In cases like my friend Lois, we often need help from a university-level hospital. We can do probably 95% of cardiology that needs to be done right here in Berks County, but there often are cases that need a higher level of care, that is to say, a good university hospital, and we're blessed to have Hershey Medical Center, and there is a very good collaboration that we believe benefits the patients of Berks County very well.
When I knew that I was going to need a heart transplant, I did some research to see which hospital I wanted to go to. Hershey Medical Center has a really, really good survival rate. There's no infection rate, and I loved it here. This is where I felt safe.
The long-term survival after heart transplantation at Penn State Health, Hershey Medical Center, is amongst the best in the nation. Almost 600 heart transplants that have been done here. This year is the 40th anniversary, and we have been embracing every new advancement in surgical technique and immunosuppression to continue advancing the field.
You know, I'm sitting here with someone else's heart in my chest, and I wasn't overweight, didn't have high blood pressure, I did not have clogged arteries. The transplant was an absolute miracle. The journey afterwards, that's when they really, really are on it after your transplant.
The immunosuppressant medications have side effects. We have to watch for them, we have to monitor them, and we have to carefully manage that. We have a very sophisticated team and very rigid protocols that we follow in order to safely apply those therapies so patients do well. And in a matter of months, they transform from somebody who's a patient first and dealing with their medical condition as their primary thought to a person who is living life, and being a patient becomes a secondary thought, and that's where Lois is now.
It's almost like a rebirth. You have another chance. I could do everything that I could do before. I'm a whole person again with Hershey Medical Center. You are getting absolutely everything that you need. You don't have to go to a big city. You don't have to go drive all those places. You get everything you need right here.
You know, I think having a strong sense of empathy and being able to put yourself in their shoes and the fear that they're going through, it's a huge, huge driver for us, not just in the clinical realm where we take care of patients, but when we are doing research, when we are looking for the next generation of devices or drugs that prevent rejection. We take huge joy and pride in being able to get people back to their families.
My whole journey, I'm absolute most grateful for it, is probably Dr. Waxler. Dr. Waxler led me on the path to recovery. Every day is such a joy. You know, you wake up and you're like, oh, I woke up.
What an incredible story and what a wonderful outcome. Joining us right now is Dr. Behzad Soleimani, Chair of the Department of Surgery and Director of Heart and Vascular at Penn State Health. Thank you for being with us.
Thank you for having me.
In Lois's case, her community cardiologist is part of the Penn State Health team where you all work together. Why is that so important?
So Lois's story is incredibly moving. To be told that your heart is failing and your only chance of living is to have a heart transplant has to be one of the most incredibly frightening news that anyone can have. But Lois wasn't alone in the journey that lay ahead of her. A team of doctors from her local community as well as Penn State Health in Hershey Medical Center got together, worked together seamlessly to give her the best chance at life. Her local cardiologist knew her well for a long time, and she trusted him. And the partnership that we built as a transplant team with him comforted her enormously and made the journey easier than it would have been otherwise.
Yes, such a wonderful journey and such a great outcome. And really, speaking about outcomes, there have been so many advancements in the field of heart transplantation. Your outcomes are some of the best in the country.
Yes, patients who have advanced heart failure and need a heart transplant are at their most vulnerable time in their lives. And we recognize this, and we focus not just on the surgery of transplantation itself, but the business of saving lives and rebuilding people's lives. And that's why we are so incredibly proud of the results of our program that's amongst the best in the nation. But every statistic is a person, is a father, a mother, a brother or sister. And what we do helps them live longer lives, healthier lives, and get back to their families.
Yeah. Well, certainly we are very lucky also to have Penn State College of Medicine in our backyard doing research. How does this research really make your program stronger?
Heart transplantation is nothing short of a miracle, but we don't just rely on miracles. We embrace advances in technology and research to find better and safer ways of doing heart transplantation and on more people. Our philosophy at Penn State is to take care of today's patients, but investigate and do research to find better ways for patients of tomorrow. And we embraced a variety of new approaches to allow us to do more heart transplants by making the transport of donor organs safer, prevent rejection. So if somebody is fortunate enough to have a heart transplant, the heart stays healthy longer and they can enjoy longer, healthier lives.
You mentioned future. Why don't we talk about the future? What does the future really hold as far as heart transplantation is concerned?
Future in heart failure and heart transplantation is bright and it's hopeful. Only a matter of a few years ago, diagnosis of advanced heart failure was a death sentence. Now with modern therapies, we're able to keep patients alive longer and with better quality of life so they can enjoy the things that most of us take for granted, seeing their children and grandchildren grow up and hiking and swimming. So that's all possible because of advancements that have occurred over the last several years and decades. Artificial heart pumps are now something that's available that are becoming safer, smaller, easier to implant, in many cases replacing the need for heart transplantation. We are on the verge of being able to use genetically modified organs from animals to use in heart transplantation in humans, and that will also address organ shortages. We are also having better understanding of how to prevent heart disease and heart failure and how to slow the progression so fewer patients would need a heart transplant. So the bottom line is that with embracing new technology and research, patients are going to have more choices, live longer, and better quality of life than they've ever been able to do.
And that's certainly what we want to hear, certainly a bright future. Dr. Soleimani, thank you, and thank you for what you do.
Thank you so much.
And if you would like more information or if you would like to schedule an appointment with Penn State Health Heart and Vascular, you can call 717-531-4554 or visit online at PennStateHealthHeart.org. Now let's check in with Janelle. What are some of the questions being asked, Janelle?
Thanks so much, Deborah. We've been getting a lot of wide-ranging topics coming up. Again, this is Dr. Sudhanshu Bhatnagar. He's a cardiologist at Penn State Health Lancaster Medical Center. Our first viewer question, very simple but common. What are the signs and symptoms of a heart attack?
Yeah, just like in the media, this is often chest pain. This pain is burning, squeezing. That elephant sitting on your chest goes up to your neck, can go to your arm. Can sometimes even go to your back. Often associated with shortness of breath, trouble catching your breath, can feel really nauseated. And then I want to emphasize this can show up differently in people with diabetes and women. So when these symptoms come on and they last for a few minutes and don't seem to be getting better, that's the time to call 911 and get this looked at.
Okay, we have time for another viewer question. Sure. What does it show? I've heard a lot about cardiac calcium tests lately. What does it show and who should have one?
Absolutely. I see a lot of patients with this. The calcium score basically shows us if there is calcium building up on the heart arteries. This is a good test for patients who have some risk factors, maybe smoking history, a family history, high blood pressure, and we're questioning, do you have heart disease? Should we start you on medication? If you're on the fence, this is a good test for you. The test does not tell you you're gonna have a heart attack. It doesn't tell you you have to go get stress tests, but it can tell us maybe a cholesterol medicine would be good for you, and it might be good to start looking into risk factors.
All right, lots of great questions. Thanks so much for answering. If you have a question for Dr. Bhatnagar, go to abc27.com/heartchat and submit your question. Stay with us. We'll be right back.
After his first open heart surgery, everybody just kept saying, You got a super heart and you're Superman. And so I think that's how we look at Kenny.
Everybody thinks I'm Superman.
1 out of every 100 children born will be born with some type of heart defect. They will be referred to a pediatric cardiologist. We can cover our patients from the very beginning to as far into life as we need to.
There are 3 core teams that make up the Congenital Heart Center, and that is the pediatric cardiology team, the congenital heart surgery team, and the adult congenital heart disease team.
We are big enough that we offer all the specialties, but we're small enough and that we can provide very personalized care.
Wherever we can, we will try to either treat or fix the problem so that they can live a life like every other child.
We as a family felt like Penn State almost became our extended family because that's how much of a support system they became for us.
You're watching Heart to Heart on ABC27, sponsored by Penn State Health.
Welcome back. Heart conditions affect millions of people in the United States. Penn State Health doctors diagnosed a Dauphin County woman with not 1, but 2 heart disorders. Krissy Baker shares her journey. 49-year-old Krissy Baker likes to spend time outdoors.
I love kayaking because it's a way for me to get out and exercise, and also to the paddling. I just love to paddle, and I go to lakes.
And that's not all.
I do a lot of work around my house in the yard, whether gardening or lawn mowing and stuff.
But it became increasingly difficult for Krissy to do yard work.
I really noticed it just, especially with mowing the yard, because I was using a push behind, that I would not be able to do my full yard, which I used to be able to do in 2 hours.
After numerous heart tests, doctors diagnosed Krissy with 2 heart conditions: bradycardia, a condition where the heart rate is abnormally slow, and atrial fibrillation, or A-Fib, where the heartbeat is rapid and irregular.
So initially she got admitted to the hospital with basically an emergency case, feeling rapid heart beats. And then after that, she ended up basically feeling fatigue and tired.
Doctors recommended a pacemaker to treat the bradycardia.
After the pacemaker was put in, it felt like I was brought back to life, honestly. It was a great way to turn it around because I had been so tired for so long, and it was just amazing how much more energy I had.
The pacemaker controlled the low heart rate, but not the A-Fib.
Sometimes we believe giving someone a pacemaker might help prevent this episode of atrial fibrillation. However, in her case, it did reduce the burden. However, it did not cure it completely. So she continued to have this rapid heart rate that are limiting her capability to do things.
Dr. Hajjari suggested a new minimally invasive ablation procedure to treat the A-Fib called Pulsed Field Ablation, or PFA.
This is a new technology called Pulsed Field Ablation, which is basically, it's a way of delivering energy to the cardiac tissue by high voltage pulses in very brief pulses, which basically achieve a cardiac ablation. What's unique about this technology is that seems to be very selective to cardiac tissue, which makes it more efficient.
The pulsed field ablation procedure was more efficient and more effective.
I will say that it's totally changed my whole, between the pacemaker and this, has completely changed my heart, and I am back to where I was before.
The biggest goal we, at least as a cardiac electrophysiologist, our goal is to make people have a good quality of life. So far she's happy.
All the people at Penn State Health did an awesome job with respect to helping me and getting me back to where I was before, being the active person that I am and not taking breaks.
Krissy's 2 teenagers noticed the difference and are thrilled with the results too.
I think that they're very, very happy to have their mom back, more active, more involved than I was in the past, I would say 2 years, year and a half.
Now, post-field ablation is an outpatient procedure. Krissy was up walking around about an hour after it was finished. Really, what an incredible story. Joining us now is Dr. Jamal Hajjari, electrophysiologist at Penn State Health, and also Krissy's doctor. Krissy is really doing great. She feels so much better, thanks to you.
Thank you. I'm glad to hear, and thank you for having me here today.
So when should someone really see a cardiologist? When they're not feeling right, when they're in, say, Krissy's situation?
Well, if the person has atrial fibrillation and then they notice no or worsening symptoms such as palpitation, shortness of breath, chest pain, some people will complain of low energy, fatigue, then they should see a cardiologist as soon as possible, especially if their symptoms are severe or interfering with daily life.
And that's what Krissy did. She wasn't feeling good, so she went to the ER. So how common is A-Fib?
So atrial fibrillation is one of the most common abnormal rhythm. It affects millions of people worldwide. In the United States, it's estimated about 3 to 6 million people are living with atrial fibrillation.
That's a large number.
It is, and it's going to continue to increase as the population ages.
So who is a good candidate for this pulse field ablation?
So PFA, or pulsed field ablation, it's an emerging technology as a treatment for non-thermal for atrial fibrillation. So a good candidate, any person who has or experiencing symptomatic atrial fibrillation, in particular people who have paroxysmal or intermittent atrial fibrillation or early persistent. And this procedure, it's even can be included in people who are high risk for standard ablation due to age or medical conditions.
Let's talk about the outcomes. Krissy is doing great. She feels great.
So the outcomes with the PFA for the management of atrial fibrillation is generally well. And then most of the people will experience significant reduction on their A-Fib episodes, with studies showing like 1 year freedom from atrial arrhythmia rate about 70 to 80% in a patient who has paroxysmal atrial fibrillation, a little bit slightly lower in patient who has persistent. However, it does vary on a person to person.
Yeah, but it certainly is making a difference. Thank you so much, Dr. Hajjari.
Thank you for having me.
And if you would like more information, or if you would like to schedule an appointment with Penn State Health Heart and Vascular, call 717-531-4554 or visit online at pennstatehealthheart.org. Now let's check in with Janelle and get some more answers to our web chat questions.
All right, thanks, Deborah. Well, our viewers have been keeping Dr. Bhatnagar here very busy. He's a cardiologist at Penn State Health Lancaster Medical Center. We have another question. Does family history play a big part in determining if you are at risk of heart disease?
Absolutely. We ask all of our patients if their parents, if their siblings have had any heart disease. Typically, those are the family members we care about most, that will listen for anybody who has had a history of it, can predict a pattern. The younger that happens in the family member, the more predictive it can be that it could happen in you.
All right, another question here. My doctor has suggested I have a stress test for my heart. Can you tell me what happens during that test?
Sure. There's a variety of stress tests. It depends on what kind of test they want for you. If you can run on a treadmill, we're going to have you run on a treadmill. If we find that we want to add pictures of your heart to help prove or disprove if you have heart artery blockages, we'll do that. A lot of it depends on who you are, what you're able to do for us, and what's safest for you.
Thank you so much. You really broke down all those questions very well for us. Dr. Bhatnagar will be answering questions all night tonight. You'll be here until 8 o'clock, so there's still time to send in your questions. Go to abc27.com/heartchat to submit your question. Back to you, Deborah.
Thanks, Janelle. Joining me right now is Dr. Michael Farbaniec, Medical Director of Cardiac Disease Prevention at Penn State Health Heart and Vascular. So cardiac disease can be prevented. That's something you deal with all the time.
Absolutely.
Why don't you talk to us about the 3 things someone can do right now to live a healthy lifestyle?
Only 3 things. Gosh.
I'm sure there's many more, but we're going to narrow it down.
So if I pick 3 things, number 1 is going to be exercise. Daily exercise, some type of daily movement does help reduce your risk of heart disease, as well as reduce the risk of developing cognitive decline. It can improve chronic pain and also improve your mental health. Number 2, I have to say, is get control of your metabolic health. So keeping your LDL or bad cholesterol as low as possible, as well as controlling your glucose or blood sugar numbers. Number 3, is often overlooked, is take time for your mental health. You know, maybe start to subscribe to a mental health practice in the morning, either meditation or some kind of a stress reduction technique, because stress itself can indirectly affect heart disease, because we often don't make very healthy decisions when we're stressed or we're sad, but also can directly impact heart disease. Chronic stress over time has been shown to cause increased inflammation, and that can lead to plaque buildup in arteries.
Very interesting. As far as the one thing you're talking about is getting your levels checked as far as cholesterol, that means going to the doctor.
Absolutely.
And that's something you should do on a regular basis, correct?
You should see your primary care physician, at least once a year. And it's important because if we don't know what your risks are, if we don't know your risk factors, we can't prevent heart disease. We need to know that. It's an important point because getting your cholesterol checked is of utmost importance, because 1 in 300 people all around us may have a congenital abnormality of cholesterol production. That can lead to increased LDL, and that can lead to premature coronary disease if not treated early.
And let's talk about diet. Diet is so important. There's some things you should eat and some things you should not.
So we talk about diet quite a bit in my clinic, and I don't subscribe to any particular diet. All diets can be heart healthy if used correctly and in moderation, but the Mediterranean diet's the one that's most kind of widely known right now. So a diet that is very high in vegetables and fruits, and also one that is full of good fats like fish that contain omega-3 fatty acids, salmon, tuna, olive oil, nuts, and also whole grains that have a lot of soluble and insoluble fibers. As far as avoiding foods, I try not to restrict diets too much. Restricted diets tend not to work because you crave the foods you can't have. But as far as what we need to limit, let's limit things like processed foods, particularly processed meats, because those can increase the LDL cholesterol. And also, I like to limit refined sugars. I define this for my patients as the 4 C's. So cans, alcohol and soda, cookies, candy, and cakes. I know, all the fun stuff, right? But not that we have to take it all altogether away, but just limit it a bit. Because if we have too much of it, this can cause insulin resistance and diabetes, high triglycerides, and high cholesterol, all of which can lead to heart disease.
Doctor, thank you so much for this very valuable information. We appreciate all this advice. And we want to thank you for spending this time with us and our viewers for sending in your questions. We wish you a great night tonight.